Hi, this is Dr. Paul, and thanks for tuning in to yet another video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about an implant. Now, what is an implant? An implant is a titanium prosthesis that mimics the tooth completely. Now, a tooth has two parts, the part that you can see, which is called the crown, and the part that you can't see, which is lodged inside your jawbone, which is called the root. Now, whenever you lose a tooth from, say, an infection or any kind of traumatic episode, you now have an area that has bone but has no tooth inside it. That's where an implant comes into play. If you ever do decide to settle for an implant, you're not really settling because it is one of the best treatment modalities out there, but you're looking at a prosthesis that doesn't use your other teeth for support and doesn't look, if planned well, awful, because the implant can be positioned in such a way that you will be replacing the natural tooth completely. Now, is an implant for everyone? Not really. If you do have inadequate bone, if your bone density or quality isn't the greatest, if you have the maxillary sinus or this large bag of air that's lodged over your upper teeth, and that doesn't have adequate amount of bone structure for an implant to go and hold on to, you might not be the best potential person to get an implant. Can things be done to get the situation better? Yes. You will need to go and talk to a dentist who will go through certain kinds of tests and exercises with you to see if you have a favorable area for an implant to be lodged into, or if you have an area which is unfavorable as of now but can be made into favorable in the future with a couple of procedures. So an implant is, again, a prosthesis that is extremely aesthetic or extremely good to look at if planned well, very good in form and function, and also is one of the best standards of care out there because it doesn't rely on your other teeth for support. Does an implant have disadvantages? Yes. The disadvantages basically are the fact that even an implant get an infection around it in the bone. The implant itself can never get infected because it's titanium, but the bone around the implant can get, just like periodontitis, you can get something called peri-implantitis. Apart from that, an implant can also be disadvantages that you might not have enough of quality and quantity of bone to hold on to an implant. And what this means is if you ever attempt to have an implant placed in this situation, most of the time, rather than not, it might end up failing. It might, surprise you the odd time where it might succeed, but usually it will fail. And when it does fail, unlike any other treatment modality, it can always heal. Just because once the implant fails and you take the implant out, that area is cleansed and kept really clean, and if there's no infection, the bone can settle around it and you should be okay to plan another treatment modality. So there's kind of a do-over in case an implant fails when you think about it. So I hope this has been of some use to you if you're ever considering an implant. The other thing I would like to tell you is an implant can support one tooth. Two implants can support more than two teeth, and this is basically what's called an implant supported bridge. There are descriptions of implants that are lodged into your bone that can hold on to dentures. These are called implant supported overdentures, and there's even a concept called the all-on-4 where implants are lodged into either your upper jaw or your lower jaw in certain angles, and they can actually hold on to an entire denture in such a way that it's mimicking natural teeth in form and function, but you don't need as many teeth as many implants to compensate for all the teeth that you're missing. I hope that kind of makes sense. If you have any doubts, please reach out to us and we can always clarify things for you. Thanks for watching.